Thank you for your interest in this excerpt from Acuitas Analytics training module on the Inflation Reduction Act of 2022, or IRA. This video shows about a third of the content of the IRA training module and is part of a larger collection of available modules detailing the pharmacy benefit. As background on Acuitas Analytics, we're a small team of professionals dedicated to providing data analytics and reporting to pharmaceutical and biotech manufacturers. We have decades of experience delivering tools, training, and sales resources to both small, single-product companies and some of the country's largest manufacturers. Let's get started with a partial review of content from the interactive module on the IRA. The pharmacy benefit. The payers, their partners, and the tools used to transfer costs and manage prescriptions. This section of the module provides an overview of the Inflation Reduction Act of 2022 and reviews its impact on what Medicare Part D beneficiaries pay for pharmaceuticals. Before continuing, please carefully read through the summary and objectives, taking notice of the key concepts that are covered in this module. At the conclusion of this section, there will be a learning assessment. Introduction to the IRA. With inflation at historic rates in 2022, massive pressure was put on the U.S. government to reduce federal spending and contain rising prices, which resulted in the Inflation Reduction Act of 2022, which became known as the IRA. Please review the three major themes of the Act before moving on to how the IRA affects pharmaceutical spending within Medicare. This brief review will focus on the last theme, aspects of the bill that affect drug pricing and coverage. The IRA implementation timeline. The Inflation Reduction Act of 2022, or IRA, has among its many goals to save families money on healthcare and prescription costs. There are several annual milestones for implementing provisions of the IRA that affect enrollee cost. In 2023, insulin cost sharing will be limited to $35 per month for Part D and Part B enrollees. In 2024, the 5% enrollee coinsurance under catastrophic Part D coverage will be eliminated, and eligibility expands significantly for full benefit Part D low-income subsidies. In 2025, enrollees' Medicare out-of-pocket spending on drugs will be capped at $2,000 annually, and these out-of-pockets can be paid out monthly across the entire year, called smoothing. The period of 2026 to 2029 will see price negotiations for a number of high-cost drugs covered by Medicare Parts B and D. We'll examine each of these changes next. How enrollee out-of-pocket spending will change with the IRA. At the time the Inflation Reduction Act of 2022 was signed into law, Medicare Part D did not have an out-of-pocket maximum on patient cost. Instead, after reaching $3,100 in drug spending, the Part D beneficiary entered the catastrophic coverage phase, in which they paid 5% of drug cost. This 5% cost was borne by the beneficiary for the remainder of the calendar year, which could amount to thousands of dollars with some branded drugs. During 2024, patient out-of-pocket drug costs are capped at $3,250. After the beneficiary reaches this amount, drug costs are shared by Medicare and the beneficiary's Part D plan, with the enrollee coinsurance responsibility set at $0. In 2025, that out-of-pocket spending cap is lowered even further, to $2,000, again with the enrollee coinsurance responsibility set at $0. Breakdown of drug costs are shared among Medicare, the drug manufacturers, and the beneficiary's Part D plan in the catastrophic coverage phase. Please take some time to examine the breakdown of payment responsibilities in each phase as provisions are implemented through 2025. How the Part D benefit will change with the IRA. An effective way to understand the impact of the Inflation Reduction Act of 2022, called the IRA, is to examine how patient costs change between the pre-IRA implementation period, IRA Phase 1, which takes effect in 2024, and IRA Phase 2, whose provisions become effective in 2025. Let's look at how the IRA impacts a specialty $8,000 monthly drug in 2023 through 2025. 2023 is considered the pre-implementation period, which reflects the current cost-sharing structure. There's no out-of-pocket maximum, so there's no relief for the Medicare beneficiary's catastrophic phase responsibility. In this example, the beneficiary is responsible for the 5% monthly catastrophic phase co-insurance for every month from February through December. In 2024, the 5% catastrophic phase coverage copayment will be eliminated, and there will be an implementation of an estimated $3,250 out-of-pocket maximum. This beneficiary will not be required to pay the catastrophic phase co-insurance for this drug starting in March. Finally, in 2025, the out-of-pocket maximum is lowered to $2,000, and the beneficiary is therefore relieved of catastrophic phase co-insurance responsibilities for this drug starting in February. Review the 3 years of enrollee responsibilities and how they are broken down between deductibles, initial coverage phase co-payments, the coverage gap, and the catastrophic phase, as well as the significant impact of the implementation of these changes on patient costs. Next, we'll examine how the $2,000 enrollee cost can be smoothed over the calendar year, so that the patient has the option to spread that cost over as much as 12 months. Smoothing of Medicare annual out-of-pocket expenses. In 2025, Medicare beneficiaries will have the option of smoothing their Part D out-of-pocket costs on prescriptions. That is, they can opt to split their out-of-pocket maximum each month over the course of the year. Therefore, in addition to the new $2,000 cap on pharmaceutical expenses, enrollees will not have to pay this expense in full in January, the first month of the Medicare year, when deductibles and out-of-pocket maximums are reset. In this voluntary program, the monthly cap will be calculated by totaling the remaining out-of-pocket costs the beneficiary owes from a prior month that have not yet been billed to the beneficiary, and any additional out-of-pocket costs incurred by the beneficiary, divided by the number of months remaining in the plan year. Review how this new provision may affect Astrid, who must take an expensive drug for multiple sclerosis. Make sure you understand how her monthly out-of-pockets can be reduced to only $167. Now, to conclude this brief exploration into the IRA module, let's take a look at a couple of sample questions. Also, note that Learning Management System components, or LMS, can be integrated into the module and the Learning Assessment quiz. What is being shown here are just 3 of the many types of questions that are available to track the user's comprehension of the topic and progress through the learning module and curriculum. First up is an exercise with multiple terms that must be matched to the correct detail. Next is a simple multiple-choice option selector to answer a question with only one correct response. Finally, there's a description of a patient with details about his condition and medication requirement, with selection buttons on prescription out-of-pocket cost. Thank you for your time in reviewing this excerpt from our Pharmacy Benefit Training module covering the changes to Medicare under the Inflation Reduction Act of 2022. What you've just viewed is selected content of a single module in one element of our training offerings in the pharmaceutical sales and marketing areas. If you'd like more information on our capabilities in other areas, including data analytics, reporting, and contracting, please visit our website at www.acuitasanalytics.com. Or, contact us at info@acuitasanalytics.com. Again, thank you for your time. We hope you've gained an insight into some of the changes to come under the Inflation Reduction Act of 2022.